that you can put crowns and bridges in with greater level of accuracy, you've got the marketability of the patients. In worlds of technology today, with PDAs, cell phones, computers, patient expect you to have this kind of things. And the other things that are in Dr. Holstein's practice, the lasers, the flat panel screens, the technology, all of a sudden we go back to taking this putty and clay in the mouth, and it seems very antiquated, especially when it comes to the seating appointment of the patient. So the marketability that it gives the patient, which is the comfort, the not having to gag. When I tell people what I do for a living, they say, oh, I hate that stuff. And what's interesting about dentistry is we're so close to it every day, you kind of take for granted about the things that are uncomfortable. When we did market research, the 3 things patients hated the most about coming to the dentist, number 1 was needles, number 2 was drills, number 3 was impression material. So you eliminate one of the things they hate the most about coming to the dentist, it's not such a bad thing. And they're fascinated to see the assimilation of their work on the screen. And you can use it to explain everything that you're doing. And what that does is patients a lot of time go, man, I just went to the dentist and it just cost me a fortune. Now it kind of lends to why the dentist is so expensive. Because the technology that they see, they understand why. And when patients don't know everything that happens in the dental office, they just sit there when they're done. It's at home when they go and evaluate it. They go to the mirror and they look in the mouth and they see the restorations. So when restorations are put in the mouth with perfect anatomy, perfect detail that look like a tooth, rather than something that looks like a direct composite or ground incline planes, then they say, wow, I go to a good dentist. I'm getting the best. So, when you see patients walking around with the black tissue stain line around central and incisor, they're probably not going to their friend saying, I go to a great dentist. There's an issue there. So when the work is capable of being put in with that level of accuracy, that level of consistency, and that level of adjustment, the patients love it. There's nothing, and I'm sure any dentist will agree, is that when you've worked on a crown and then you have to go in and grind the opposing, they go, oh, what are you doing? We're not working on that tooth. And if you really think about how crazy it is to be grinding on the opposing for something that we're not even working on and there was something that fit in there before, it is pretty archaic when you think about that. And when you go to dentistry that no longer has to be done that way, it's pretty refreshing. And there's thousands of iTero dentists that experience that every day. So that's the real step up to technology. I love to draw the comparison of digital x-ray. Once you go to digital x-ray, could you imagine going back to the film and conventional processing? Once you've had a cell phone, can you go back to driving to a payphone and using it? It's simply developments that create higher standard of dentistry. Doing dentistry at a new level of accuracy is a very refreshing feeling. A lot of doctors say, hey, well, I don't have any problems with impressions now. I don't have variables. Everything is pretty smooth. But the best comparison of that for those of you who wear glasses is that you kind of can compensate with your sight, and then you start to realize it's going on you a little bit, and then when you finally go back to the doctor and you get the glasses put on and he's putting the lenses in front of you, you go, wow, I really am missing out. You've become accustomed to seeing things that way with a little blurry and a little bit of uncorrected vision, but you've dealt with it. Until you see it in proper light again, that's when you realize, maybe I could have done it better. By the way, I'm going through that struggle right now in my own life. But when, again, crown and bridge dentistry is the same. When you've done the compensating steps for so many years and you're used to it, you start to forget what it's like to have flawless dentistry done. And that's really the change in the way a doctor thinks or sees these restorations going in.